Welcome to the podcast, Dr. Brannon. We'll call you Greg from here on out, but it's delightful to have you here. We're going to be talking about hormone replacement therapy today. That is definitely your area of expertise, and many, probably the vast majority of my listeners are very interested in this topic. So it is lovely to have you here today and to talk with you.
Well, thank you very much for the patience, Shannon. Thank you so much.
Yeah. Well, just give us a little bit about your background. You were an OBGYN for 30 years, I think you told me before we
Mhm.
started recording. So you have delivered, been on lots of deliveries and helped women, with that area of their life as well. So tell us a little bit about your time spent there and then how you got to be so interested in hormone replacement therapy and then wrote a book about it as well.
Well, thank you. As an OB, my whole life in medical field, I just loved it. I delivered about 12, 13,000 babies. I love women's health care. I think maybe being raised by a single mom, I saw the amazingness of what a woman can do. I ended up having six girls and one son myself. So women are a very important part of my life, obviously. But as an OBGYN and in the amazing stages of a woman's life, from teenage adolescence to the 20s to their baby fertile time to menopause, all these beautiful landmarks in life, right? And when women are having complaints, you think about it, the answer is just reflection, just knee reflex. Here's an antidepressant. It's like the word hysterectomy. All the body parts are named in Latin, but when you remove them, they're named in Greek. So to remove a uterus is a hysterectomy. They called it that because a woman is quote unquote crazy. So you remove her uterus, she'll be crazy. So same thing's happening 3,000 years later. A woman has these changes, and oh, here's an antidepressant. Well, how about that's a symptom? What if that's a symptom that the brain ain't talking? What if that's a symptom? We don't think it that way. We think it's in your head. And what drives me crazy, yes, it's in our head because our brain is in our head,
Yeah.
right? And so it's the lack of this whole idea sometimes in medicine is America's great for sick care or for wellness care, for preventive care. I think root cause is it. So during my process, I've never been anti-hormones in treatment,
Mhm.
but I didn't know the difference between synthetic and bioidentical till I started educating myself at 15, 16 years ago. And it started making more sense to me thinking that pharmacy companies cannot own an organic molecule. So they got to make a structure and tell us that structure is superior to the one your body makes. The onus is on them, not on the bioidentical. There is a difference between ethylene estradiol and estrogen. There's a difference between progesterone and natural progesterone. There is a structural defect, a metabolic defect, a utilization defect, and I think that's what sort of got me into that whole mode. And the big famous 2002 WHI study, it's called Hormones, Prempro, the one that was studied bad, but had some good benefits, got me realizing, well, is there a better way? And that's what made this whole pathway because I believe when women complained about certain PMS, postpartum depression, menopausal symptoms, it was not make believe. And that was my passion, was to find an answer. And then in my own life, I looked at the same things happen with men. If I asked you or any doctor, anybody, what's the most abundant hormone in the human body? They may say insulin or cortisol or DHEA. They'll say something. It's testosterone. In fact, women in their 20s make 50 times more testosterone than estrogen. That's what drives me crazy. It's not a male hormone. It's an
Right.
androgen. I have androgens. I have estrogen. You have androgens. You have estrogen. But the proper ratios, we'll get more detailed over time because these ranges have plummeted in the last 50, 60 years. So how can anything be as efficient if it's 20% of what it used to be? And we'll go over why it's lower, but those have huge effects on brain, heart, breast cancer, prostate cancer, diabetes, overall health.
Absolutely. Well, bless you for raising 6 daughters. And then
My wife's a saint. My wife's the greatest.
that's a lot of menstruating going on. So
I,
I had 6
yeah,
sisters, and you do, like, as women, you tend to sync up when, and it all kinda hits at one time. But yeah,
and my three golden retrievers are girls too.
are
Yeah,
all
it should.
girls. Yeah, we have all female pets here. I have 2 sons, and I laugh my butt off at them, and I have a daughter too, but yeah, that's a lot of girls at one time. But I'd like to go back to talked about the synthetic versus the bioidentical a
Yeah.
little bit. Which ones are you using in your practice? And then are you using any kind of plant bioidenticals
Okay.
or
I'm using
over that and
strictly,
kind of tell people what the difference is
yeah,
and why
I
you're doing one over the other.
yeah, I do not use synthetic. I use bioidentical that are based on the actual precursor is either from yam or soy. But
Okay.
it's important to understand is everything's man-made. I mean, it's all synthetic. It's got to be man-made. But the final product, what does it look like? The Mayo Clinic says bioidentical is equal to body recognized as same. So it has no idea if it's made in your adrenal glands, your testicle, your ovary, or in a lab because the body recognizes the same. And I use pellets, and we'll get in detail. A pellet is a compressed, pure hormone that secretes at a steady state. It's been used in women since 1935, men since 1937. It's crucially important to understand that the pellet, the actual structure, leads to its function and therefore its stability across the line because in our body, testosterone converts to estrogen, estradiol, and an enzyme called aromatase converts them. And that steady state of the testosterone being exposed to aromatase is crucial because every single cell in the body needs testosterone and every cell has a different demand for estrogen. So you want a steady state. And the synthetics have half-lives that are very short, go up and down, or the route they're absorbed, they take orally, it has liver eats it up first, liver first bypass. So I was trying to mimic the testicle ovary. So it's exactly the way our body makes it. The structure is called the gonane or sterol. That's the 4-ring base that comes from cholesterol that actually makes the structure for estrogen, testosterone, and progesterone.
And I love how you tie it back to cholesterol because we've been told not to eat cholesterol for so many years.
Oh, I could spend hours on
Don't eat
cholesterol.
cholesterol. And
Oh,
cholesterol is the base of all of these. I always say, if you don't want your sex hormones, I mean, they come down line of so many other hormones. They're like way down the line. But if you
cholesterol,
want some
without
good,
cholesterol in the
yes,
womb, we're
there's
not
nothing.
here. We're not
Right.
here.
Yes.
Your brain is 75% cholesterol by weight. Every cell in the body is at least 50% cholesterol. Um, it's the whole hypothesis of statins lower cholesterol. It's garbage. It's sugar oxidizes the LDL, which then makes it denser, which causes the oxidation. It's not the cholesterol. We can spend hours on that.
I know, and I wish like we could show everybody the, like the hormones that are what starts with cholesterol and goes to pregnenolone and
It's
then
in my
it
book.
goes up. Yeah, there's like, then it just shoots off and goes down all these different pathways. But if you don't have the cholesterol to make, so I'm always say, if you want some good, good sex hormones, you need to eat fat, like natural fat, and you need protein, and otherwise you're not going to be able to build these things. So I'm glad that you tied it back to that. And that helps us look at, why we're using bioidenticals versus synthetic. And yeah, I know.
I'll give an example. This is an example of synthetic.
Yeah.
Synthetic progesterone, medroxyprogesterone, levonorgestrel, the ones that are birth control pills, increases breast cancer up to 69%. In birth control pills, it's 30%. Natural progesterone lowers breast cancer risk. So synthetic progesterone increases heart attack, principal type of heart attack, dementia, and breast cancer. The bioidentical lowers all three of those, just the opposite. Just because the key fits in a lock does not mean it turns it on properly. That's why three-dimensional structure is crucial. And how it's utilized is great, how it's metabolized, and then how you eliminate it. All these things are important. That estrogen has an alpha and a beta receptor. You want to have more beta than alpha. It's just biochemistry applied properly. So yes, I don't want to, again, and my biggest thing on this, pharmacy companies cannot own organic molecule. Therefore, they cannot make profit on it. So again, I believe the onus is on them to tell me that the structure they make is better than what the body makes. That's baloney. The one your body makes knows exactly what to make. The problem is our levels are significantly lower because of the environment of the phthalates, the pesticides, the organic phosphates, the plastics. They are endocrine mimickers that are destroying the production of testosterone in both men and women.
Yeah, let's talk about that with the levels of the testosterone and how that's just changed over time. And that's not the only lab marker that we've seen. Like I've seen other things just start to just all of a sudden the optimal ranges are changing because we're getting sicker and sicker and sicker. And we're just basically adapting these levels to sick people, which is crazy. So yeah, talk about what's happening with the testosterone and what you find to be actual optimal levels versus if somebody went and got their testosterone tested, men versus women, and why that range is changing so
This is
much.
what this is what I fix it, Shannon, in the sense that in our body, from the womb, testosterone is formed first, and then estradiol comes from that.
Mhm.
Estradiol goes back to the hypothalamus and turns everything off. So it's a great negative back feedback loop system. What happens is if you expose that system to foreign estrogens, like we talked about, the phthalates, the pesticides, the organic phosphates, it will trick the body with a lot of estrogen, and our body goes, "Oh, estrogen comes from testosterone, therefore thus testosterone," and then it stops making it. So the range, I'm 63. So when I was in school, the range for a male, and again, it's not a number like diabetes, a blood sugar over 100, you're diabetic. It's a range. They get a bell curve, 80% fall in that standard deviation either way. When I was in school, for a male, was roughly 800 to 1400. Okay. If you fall in that curve, you're considered normal. Today, that same curve is shifted left. It's between what lab you look between 150 and 700.
Wow. I mean,
Now,
that's not just a little bit. That's like
yes, exactly. And a
substantial.
woman was roughly 70 to 200, 250. Now a woman is 3 to 41.
Wow.
So today's lower men was actually higher women 50 years ago.
Yeah.
Today's 20-year-old man is basically what an 80-year-old man was 50, 60 years ago. So the doctors look at the lab and go, "Oh, you're within range." In my new book, I have a whole section on how they made these ranges and how it changes. If you're looking for an optimal blood sugar, I know you're an expert in diabetes, we're looking for an optimal blood sugar, and you have 1 billion people in the study, great number, and everybody's diabetic in the study. The numbers are irrelevant. It's
Right.
irrelevant. And what happened is that we have no unskewed population base. We're all been since the womb. I know if a 25-year-old boy walks in my office, I know he's probably half what I was. You think it's just the
Right.
opposite. Testosterone is getting plummeted from the womb. So again, let's look at the cause. The cause is outside sources. So try to eat like you recommend, fats and proteins and filtered water, walking, exercise. That's crucially important. But I cannot affect things that have in the womb. So, but now, how do you know your overall health? I call it the pre-plastic era. I look back as far as I can back in the data from the 40s and 50s and what was a normal guy then. The study I used for men was a study from the 40s and looking at Army recruits, 18 and 25-year-olds, and they were 800 to 1400. So why cannot that be good today?
Right.
That's because when you look at the data, there's no data showing that high endogenous testosterone is detrimental or high bioidentical. It's just the opposite. The higher you are, the healthier you are.
Yeah. Well, and I looked back on I had my hormones tested about a year ago. And I looked back on my testosterone just in preparation for this to see, where I was falling in line, and mine was 46. So it's interesting that today I'm like high, like above average, but 50 years ago I would have been low, like
So,
not
but
even. So
but
it's like,
you know why you're
well, is
46?
that actually optimal?
Yes. Yeah, look,
It's
understand 46 at you're probably late 30s, late 40s. You work out, you eat properly, you've done the best you can, and 50 years ago you be considered sick, right?
yeah,
But again, my wife was 3. My daughter was 3, my wife was 7. So the answer is yeah, that what you're doing is great. Those are great things to do. But how much more efficient will your body be if you're in the 150, 200 range?
yeah,
And again, the range is very subjective because we are set genetically. So I really see how you feel because people come to me. Here's what they come to us for: tired of being tired, brain fog, mood, anxiety, depression. People think testosterone, think sex and muscle. That's like number 7, 8 down the list. It's brain fog. It's the brain talking. It's it's
yeah.
it's when you look at every single cell needed. It's insulin sensitivity we talked about. These are things that testosterone does. So how efficient can we be if our fuel was optimized?
Yeah. Well, let's talk about testing a little bit and what you are recommending for optimal testing, because depending on what hormone you're looking at, there's saliva, there's blood, there's urine for some of these hormones. What are you recommending for people to get tested? What are they asking for? And is there a recommendation you have for blood versus saliva versus
I'm purely
urine?
blood. It's the gold standard for testosterone, estrogen, progesterone. Um, Saliva is great for cortisol. So when
Yeah,
I do adrenal tests, I use cortisol.
yeah,
Um, I use saliva because I get a curve. I get forward throughout the day to get a curve. And
yeah.
then I built a program. I have 4 stages of insufficiency based upon when you fall in that curve. And I also get DHEA, pregnenolone with that. So that's my adrenal side of it. But the hormones, I do blood. There is definitely a estrogen is very tricky because estrogen has a intracellular level and an extracellular level. And all we measure is the extracellular level because every cell amount is concentrated based upon the aromatase. Like bone needs a lot of estrogen, so they have more aromatase. Um, Prostate in young boys have none. There's no aromatase. The reason why men get prostate cancer over time, I believe, and a lot of good writings on this, is testosterone suppresses the formation of estradiol, which leads to this cancer, BCL-2, a protein. But as you lose testosterone over time because of the exposure to the xenoestrogens, then aromatase turns on and increases the alpha receptor. Prostate tissue and breast tissue are a lot alike. Estradiol alpha is bad, estradiol beta is good, and testosterone suppresses all cancer growth. So when you say, what labs I want is each was what we're doing, but for me, it's blood is the gold standard for the sex hormones.
Okay, okay. And does it, I would imagine if you're still menstruating, you're testing some of these things at certain times of the month, or
Yes,
how are
yes
you?
and no. Yes and no. If I was doing infertility, if I was doing PCOS within
Yeah,
in my head, I'm thinking that, but now I'm not gynecology anymore. So no. So I don't, it doesn't matter like what day you get. I know if I get a 30-year-old woman and her progesterone is 0.2, I know she's pre-ovulatory. She's she's a proliferative phase. If I get your blood and progesterone set of 7, I know I got her in the luteal phase. But I'm not going, if I was doing infertility, I always did progesterone day 21. But no, we're not doing that reason. And estrogen changes every single day.
yeah,
Estrogen before you ovulate hits between 2 and 400. So you're going to look and go, oh my gosh, my estrogen is high, but it's supposed to be high in a 30-year-old on day 12. But then it's
right.
low again back. So I don't believe women or men in general are estrogen dominant because of the hormones we make. We become estrogen dominant because of the xenoestrogens
Yeah.
affecting our bodies part.
Yeah, let's go back to that a little bit with the testosterone and what's depleting our testosterone over time. We talked about the plastics a little bit. That's a big one. And we talk about eating organic foods on this podcast a lot and non-GMOs.
Oh,
And, I would say even 10 years ago, people were like, oh, there's no difference. But like now the studies with Roundup and glyphosate and other things besides that. But other than plastic organic food, what are your thoughts on how EMF exposure or the electromagnetic field
oh,
coming
good.
into play and the blue light? And like that is a huge
Blue
thing
light,
I'm
a
deep
blue light.
diving into
Yeah.
right now. And I'm just like, our lighting environment plays a huge role in our
And
health.
a blue light decreases testosterone formation. I'm glad you brought that one up.
Yeah.
5G. The studies right now are coming out from 1 and 2G. That's how far back they are. These microwaves are very large. What are they going to do? We don't know yet. Dr. McCullough wrote a great book called EFT, EMF, it's called. So there's a lot of great science. You think about it, we're basically a battery. Our heart produces voltage. We are a battery. Every cell makes it. So how could you not mess things up over time, right? So, we talk about some of probably the most potent xenoestrogens. You have atrazine turning male frogs and male fish into female. Genotypically, they're male, but phenotypically, they're female. But the biggest one in humans, I think, is phthalates because it does a bunch of things. It stops the production of testosterone. It increases the affection of aromatase. It actually acts like estrogen and increases the metabolite of estrogen. But it does everything possible to make a hypoestrogenic, low androgen situation. That's
Yeah.
probably one of the worst.
Yeah.
And there's hundreds of them within that group. And so I think that's it. But what you talked about in your podcast is basically that's why my book's called Restore. I want to go backwards to go forward.
Yeah.
Our body knows what to do if it's given sleep, water, exercise, fat, and protein, and remove stress. It knows what to do. I mean, 90% of our diseases here today, we're not here, but either it's 90% of our food. You go to Europe, they don't use Roundup. And it's Roundup, glyphosate, affects the structure of gluten. So gluten is a different structure in America than it is over there. They don't have Hashimoto's as much because of that. They don't have irritable bowel syndrome because of that. It's all these plethora of things just pounded upon. It's not one thing we can do. But I don't want people can become catatonic, go, oh my gosh, I can't live. No, no. The body is a great filter with the skin, the liver. There's things to do if follow your advice. Like organic, I mean, for 6,000 years, we ate red meat and eggs. Yeah, eat fat, eat protein. Those are things we used to do, and it actually healthier, beneficial. Hong Kong has the highest life expectancy in the world. They eat a pound and a half of red meat every day, 97 years of age. So yeah, I mean, obviously you and I are in the same, are tuned to the same thing on this. But what I use in my office is this. I say we're all Ferraris, and people come to me complaining. They go, my Ferrari's not driving. I've washed it. I've waxed it. I put air in the tires. I even put a new paint job. I go, great. Is there gas in it? I just give gas. Once you give gas, then everything else will work. But you need the testosterone optimized. I'm a big believer in checking the thyroid as well. Our thyroid numbers have decreased as well because they put bromine in our food, the halogens of fluoride and chlorine, took iodine in our food. So it's plummeted. Women are 9 times higher for hypothyroid disease because of the environment, as well as the vitamin D and sunblock. We could just go down that path.
Yeah.
But get the thyroid optimized, get the sex hormones optimized, and then everything else builds upon those foundations.
Sure. Yeah. And we've talked about the plastics before, like going to stainless steel or a glass drinking vessel, just that in and of itself, going from plastics like that far. And, my kids haven't drank out of plastic. We have some plastic water bottles here just in case, like they need, like somebody is here and they need to take one with them or whatever. But I'm like, nope, you can't. You're not drinking out of those, especially if they've been in your golf bag for 2 months or whatever. Like you're not doing that. We do the organic whenever possible. And I think it's worth mentioning too. Like we're coming into spring here. I just ordered a CSA box from a farmer 30 miles away that is delivered to me every week. And like my goal this summer is to try not to grocery shop, as little as possible, like go to farmers markets and
Yes,
eat your local environment because that's the food that's,
local rights, free
yeah.
range.
And that's the food that you should be eating,
Right.
and it's not shipped from halfway around the world. But yeah, I'm doing more of a little bit of a dive into the EMF exposure, just because it's and the blue light, because it's just tanking so many things with our health. And my middle son right now lives in a dorm. I'm moving him out in a couple weeks. He's done with his freshman year, but I'm like, oh, I cannot wait for him to be out of there. It's just like, like all that EMF in there and, the Xbox at all hours. And I'm like, my boys think I'm nuts. I'm like, don't put your cell phone in your front pocket by
No,
your
no, that's enough.
tools. Like, don't.
To decrease sperm. Well, that's
Yes.
shown. I mean, this is real stuff. We need sunlight. We need infrared light. We don't need blue
Yes.
light. It's a different wavelength. I mean, just think that the 5G is a millimeter. These are huge waves of energy. So,
Yeah.
and the thing is, we don't know the results until 1, 2, 3 generations down the line.
That's
That's the
exactly it.
problem. And again, every animal, every plant, all turn to sun. We go to sun, and then we block it. We block it because it's hypothesis of cancer, but skin cancer, if you look, it's vitamin D is the culprit, or low vitamin E because we put sunblock over the sun. If there's all these things work together, we just bombard ourselves. But yeah, you're not out there. I agree. What you're talking about is real. And
Oh, and it's like you said, it takes years for this to come to fruition. And things that I was talking about 7 years with my kids, they're now like, oh, so and so is now doing this that you, like now people are talking about grounding where I was telling, like, get bare feet, no sunblock. Like we're gonna be those people, and it takes so long. But yeah, and the blue light is fine during the day, but not at night when you're supposed to be
well,
going.
when you wake up, your retina recognizes it, goes away. Then at
Right.
night, time it goes down. You're like, yeah, I mean, the body's amazing. Amazing. The
Yeah.
body's amazing.
Yeah, and you have all these spectrums of light all day. You don't just have the one blue light that's coming in from your computer or phone. But yeah, so I think we're going to see just so much more
Well,
information.
let's go over sperm in your son's phone. We know, as I said before, we've lost 1% of sperm every year since 1970, 2% to 2002. MIT and
Very.
MIT and Hebrew University did a study that showed by 2050, men in North America, Australia, New Zealand, and Western Europe will be fertile. For 30 years and 25 years from now, we're gonna be fertile, and we just say, "Oh, don't worry about it. Keep doing the same thing." Like there's not. We got to look at this thing before it becomes more of a problem, and we
Right.
have this kind of rate of infertility. 4 to 10% of men under 35 have no sperm at all in America.
Yeah, that is
And again,
correct.
if sperm correlates to production of testosterone, that's the epidemic of low testosterone. However you believe religiously,
Yeah,
I believe in a creator, but you don't have, so species ain't going to be here if we
right.
continue.
Yeah, it's incredible and not not in a good way. Well, going back to the testosterone again, because I know like that is super important to optimize. Are you using pellets or creams or what is
Only
your
pellets,
thoughts? Only pellets. Okay.
only
Tell us
pellets.
about pellets because I'm sure there's people like, what the heck are pellets
Yeah,
and what do you do? How do you insert them and all?
smaller than a grain of rice for women, but a little larger than a wild rice for a man. And it's pure hormone wrapped in a fat. The fat we use is cholesterol, and so they're both bioidentical, and they're basically compressed. Now you put into a fatty area which is moist. Now as the fluid goes over that pellet, it actually takes the top layer off at a steady state. That's the key, is the steady. It goes under the skin. I use it in the buttocks area, outer buttocks area. It sits there. The incision is about 2 millimeters for a woman, about 3 for a man. It takes us about 30 seconds to place a woman, about 90 seconds to place a man. I built an algorithm, an augmented one, that has based upon, it's individualized for you. The dosage is individualized for your symptoms, your size, where you're at, how you metabolize it. And then we check your levels in 1 month for and for both men and women. 3 months for a woman, we place every 3 months, a man every 4 months, and it stays stable the whole time. Now, when you work out, you get a rise. It acts like it's like a depot. So the answer is, I'm mimicking the ovary, mimicking the testicle. I'm trying to put you into the, and then in a perimenopausal woman, when I see your FSH go up, I'll add a little bit of estrogen and progesterone so that you'll never have a hot flash. You'll never have any dryness. Women lose 5% of bone every year in menopause. With pellets, you gain 8.3% per year. You decrease dementia up to 300%. It's basically, we trick your body to believe it's still 25, and there's no detriment to that. I think aging is great. The wisdom of getting older is fantastic,
Yeah.
but I like that youthful chemistry, and that's what we're doing.
Okay, so I always thought the bone loss and the brain fog was more due to estrogen falling, but it's more testosterone.
I know
It's a
testosterone.
combination of both.
Well, where
Testosterone.
does estrogen come from? Testosterone.
Yeah, that's what I was gonna ask. Is it just because then the estrogen, so if you had low levels of testosterone, estrogen, and progesterone as you're going through perimenopause, menopause, could you just use the testosterone to
Some
optimize, or would you do all
some
three?
doctor recommend just testosterone. I think adding a touch of estrogen is important. The
Okay,
key is not to get too high or too low based upon your values, and make sure breast cancer, uterine cancer must be balanced with estrogen, progesterone, and Provera. So there's a thought of that no estrogen. Some people believe that. I'm more moderate estrogen, but it's important because we know estrogen decreases Alzheimer's. So but like the bone, I'll give you an example. Testosterone and progesterone make bone. Estrogen slows down the absorption. So that's why in menopause you have no making of it, and you have a faster reabsorption of it. So it's that balance. So why wait till osteoporosis occurs and then give you these medications that break your hip and break your jaw? We can avoid it all together. Number 9 leading cause of death. We can eliminate it all together by being on pellets. Again, I can't stress enough. Gaining 8.3% of bone per year I have women who their doctors get a bone scan every few years, and they're getting bone, and their patients are saying to the doctors, but it's the pellets. The doctor, nah, it's not the pellets. Never heard of that. I mean, that paper was published in 1979, the American College of OBGYN. This is not new stuff. It's just people don't get it. They don't understand the whole idea of it. Breast cancer. Breast cancer is decreased by Dr. Glazer in Ohio has shown a 40 to 60% decrease in breast cancer on pellets. decrease because it suppresses the production of estradiol alpha receptor sites. So bottom line is a healthy, youthful person has less chance for disease processes. And that's the goal with OptoBio. I've been very fortunate over the last 12, 13 years. I've probably had over 60,000 placements. We have 8 offices in 5 states. We have a 90% retention rate. It's just, once you taste it, you're going to go, oh, this is how I'm supposed to feel. I don't know what to tell you. You know what I mean?
Yeah, yeah. Is there a time where, because I've heard the whole if you're 10 years beyond menopause.
That has to do with
hormone-
PremPro. That's to do with PremPro, which has a slightly increased heart attack risk the first 6 months. After that, it falls down. There's a book called Estrogen Matters at USC that has shown that paper that even PremPro is superior to nothing.
Okay.
I disagree on the Provera part. They don't talk about testosterone at all. But the WHI paper is very interesting. They use PremPro because it's the most common one used. They showed women with Premarin by itself had a less increase in breast cancer, but they had increase in blood clots and liver problems. The PremPro arm with the synthetic Premarin, which is pregnant female horse urine and
Yes.
and Provera, increased breast cancer 24%. It's skewed a higher population. The guy in France, Dr. Fiornero, did a study of 134,000 women. He gave them bioidentical estrogen, bioidentical progesterone, bioidentical estrogen, and peroxyprogesterone, the synthetic. In the bioidentical arm, 10% decrease in breast cancer. On the synthetic arm, is increased 69%. It's the Provera.
Wow.
Now, when you add testosterone to it, I can't stress enough, it decreases it by 40 to 60%.
Wow.
Same
Wow.
thing with prostate cancer in males.
So you have a woman 20 years post their last period, they would still get benefit.
I saw my mother-in-law when she was
from-
80, and she, again, there's a slight risk the first 6 months. I've never had one in 13 years. And
Okay.
but listen to this. This is important. The chance of a woman dying of breast cancer is 1 in 7 times 0.03. Okay, basically 1 in 2,100. The chance of a menopausal woman dying of a heart attack is 1 in 2.
Right. Yeah.
This
Like,
is,
which one would you
yeah,
choose?
it's the
One
benefit.
sounds better.
My new book, Restore, I have a whole section on showing the data on a woman not on hormones versus hormones for the heart, brain, and the dementia rate. I mean, dementia is 75% of all Alzheimer's patients are women
Yeah.
because of the lack of hormones. The hormones are protected.
Right. Right. Yeah. And I have a pretty big community at this point. And, those are the things that I hear a lot. Like, oh, I'm more than 10 years post menopause.
Again, they're equating synthetics. They're equating the synthetics.
Yeah.
And it's the first 6 months, and that's it. And even that plummets after 6 months with the synthetics. Okay, there's no arm in the bioidentical, but in my book, I have a whole European study on over there on the data on that. It's just the opposite. It's just I can't stress it.
Yeah, that makes sense. The other thing that I hear where women are fearful of exploring the hormone replenishment or the hormone therapy is if they've had some kind of reproductive cancer, like breast cancer, ovarian cancer.
Well,
What are your thoughts on that?
Well, I use that if you've had breast cancer, estrogen receptor positive or negative doesn't matter. I give no estrogen at all for the first 5
Okay.
months. I give
For the first
testosterone
5 years that you said?
first 5 months for breast cancer. For
Okay.
uterine cancer, it's 2 years. Now, I believe giving a aromatase blocker called anastasol, actually, Dr. Glazer has the breast surgeon out of Ohio, has some great data on that. And in her pellets, she puts anastasol. I do as well for certain of prostate cancer, and I'm putting together a pellet for breast cancer as well. So the answer is we manipulate the treatment just a touch, but the key is the testosterone is the anti-tumor, is anti-cancer.
Okay.
Cancer cells love this protein called BCA range, but testosterone is a suppressor.
Okay. I lost you there for a little bit. You were saying that the protein, they love the
It's a
protein.
BCL-2. Cancer cells love that. It protects them to grow. And testosterone, progesterone, and estradiol beta negates it and attacks that. Okay, it's the estradiol alpha, which again, you can balance out very well by keeping it in proper levels.
Yeah, it's like women, I mean, not just women, men, you hear these things and they get around and then it's just like,
Well, I'll give you one.
that's what people are hearing. Like, I can't, I'm 10 years
give you-
past, I had breast cancer. Like, I can't do any of these
I'll
things.
give you one for prostate cancer. prostate cancer. We know testosterone therapy causes prostate cancer. That's what we heard. That paper was published in 1941 by
Wow.
famous Dr. Huggins and Hodges. In fact, Huggins won the Nobel Prize in 67. How many men were in that study? One. One.
Wow.
And he's already castrated. He had no
Oh,
testosterone.
oh my gosh, that's
And
crazy.
that's what he's quoted today. Dr. Morgenthau from Harvard wrote a great book called Testosterone for Life. It goes in detail that he actually gives his cancer patients certain criteria. Will give them pellets. So he has a 56% recurrent treatment rate by going on pellets. So it's just cancer's out there. I
Yeah.
got it. So make the immune system as strong as possible. Make your body as strong as possible. And that's what testosterone, heart, the actual molecules that causes the atherosclerosis is inhibited by natural testosterone, just
Mm,
the opposite. But
sure.
there are synthetic testosterones, three categories that have benefits, but they have some side effects. So you gotta tweeze out in the studies the bioidentical versus synthetics.
Sure. And you work with a lot of male clients
I'm
also.
55% women, 45% male.
Okay. Yeah. Yeah. So, I
My
mean,
average, my average patient is 37 to 42.
sure.
Mhm.
Wow. 37 to 42.
That's my average age patient.
Wow. Wow. Yeah. So I do have men listeners as well. Like if you have low libido, low
Again,
energy.
I don't care if you're a man or woman, I don't care what your age is. Tired of being tired, brain fog, moods. That's what it is.
Yeah.
Men, grumpy old man syndrome's gone away in 2 weeks.
Yeah. Well,
About
that's
80% of my patients who come on antidepressants are off in 4 months.
That's amazing because it's crazy because just on Instagram today a friend of mine who's a big hormone, she's a dietitian but she's focuses on hormone perimenopause and menopause, and her daughter is going through nursing school right now, and she was taking a test, and you're not going to love this. It's like you're going to love it and you're not going to love it. Like her question was, a woman going through perimenopause and menopause is showing depression and
SSRIs,
energy.
SSRI.
What do you do? Yes, and that was the answer because that's a standard of care. Put her on an antidepressant.
We said that a half hour ago. We take the uterus out because it was crazy. Okay, that's where the came from, right? So now we'll go through changes. She's losing her estrogen, her testosterone, progesterone. That's what she's losing. We know that. Here's the antidepressant. Well, how about replacing the hormones that she's losing? You would never give a diabetic who needed insulin. I'm talking a type 1 diabetic. You would never give a type 1 diabetic has no insulin more cortisol. Like you would never do that. Or you never give a here's an SSRI because you're depressed. No, I'm hypoglycemic. Hyperglycemic. I feel miserable, so I'm diabetic. You'd give the hormone that resolves the issue. And that's the problem. We're putting band-aids over the cause. This should be root cause medicine. Our body runs. Again, the most abundant hormone in that human body is testosterone. In the last 50 years, we're probably 80% lower. Why not fix that problem first?
It makes sense to you and I. And on that question, one of the answers was give HRT. Nope, that wasn't the right answer. It was put her on the antidepressant because that's a standard
Yeah, number brain.
care,
Now,
man.
there's the case. I'm not saying I'm not a big fan of them at all. I'm sure there's a case for those, but not 80% of us.
Right, right. And not as the standard of care. Like the standard of care is just like one thing. It's not looking at the
What
entire,
if the
it's not
standard
looking at
care?
you as a person. It's just looking as you as a diagnosis.
What
And
if the standard care is wrong? Give you an example.
well, exactly.
We gave thalidomide and we gave
Right.
DHEAS for recurrent miscarriage. We had babies with no arms and reproductive health. Just because that's the problem. I'm a freak on individual liberty. I'm a freak on that.
Yes.
You have to decide your life. We're not all experts as electricians or expert doctors or expert science. I got it. But we're ultimately responsible. And I think liberty demands responsibility. So I believe the king and queen is in the mirror. They're in the mirror. Get your counsel, ask some advice, but ultimately you're in charge. And what may be good for me may not be good for you, but you decide. I decided. That's true freedom. Not be told some quintile that 40-year-old men do this or 30-year-old. That's garbage. That's not true science. That's not true science.
Right. Oh, I couldn't agree with you more. So let's go back to the blood sugar thing. I'm one of these women right now where it's like you're doing all the things. You're only eating a couple times a day. You're not snacking, you're eating a lower carb diet, you're exercising, you're sleeping, but you still have like this high morning blood sugar creep. In your experience, I know everybody's different, and this could go back to a couple of things. Is it more of a cortisol response that you would think that's happening, or is it more of the sex hormones that are changing and you're growing?
Testosterone in 6 months optimized will lower hemoglobin A1C by 17.3%.
Okay.
How about
So,
that? It
okay.
actually makes this insulin receptor more sensitive.
Right. Okay, that makes
Therefore,
sense.
so
Because I
therefore,
have women who, the cortisol response is happening, the dawn phenomenon around 6 a.m., and you get the surge of cortisol and you see your blood sugar go up. But then I have women who are, fasting throughout the morning or, till 10 or 11, and their blood sugar is 100, 105. They haven't eaten yet. And then once they eat, then it's going down into the 80s and the 90s. I mean, obviously you're releasing some insulin so that you get
there's a the Dr. McCullough, Dr.
yeah, yeah.
McCullough,
Mhm.
he just came out with the Randall cycle.
Yes, I saw that.
Yeah, and it's very. I've been following McCullough for a while, and I wrote a paper in college on gluconeogenesis, which makes a lot of sense. I do believe that he's very clear on this. You add back the simple fruits to the mitochondria as an option to either use fat for beta oxidation or sugar for for Krebs cycle, or because the less efficient is glycolysis, right? That's the less efficient one. But you want to be able to do all of those. But it's very clear that once you become after we're not insulin resistant, because that's the first issue. The
Yeah,
first issue is you got to become flexible, right?
yeah.
And the problem is the food pyramid is that's the fad. The
The
food pyramid
strategy,
is the
isn't it?
fad. And you look back at the American Heart Association was paid off by the sugar corporation, linoleic acid. They've known for years that saturated fat was good and cholesterol is good, but sugar and omega-6 are bad. And then they build this food pyramid based upon grains, which is like, oats are for for horses. This is garbage. But we did not really, we really didn't put I mean, Jason Fung talked about this great, his book, right? In Obesity Code. So the thing is, we have to understand is the government made this plan with outside sources. No, for 6,000 years, we eat fat and eggs and meat and protein and walk around and lift heavy things now and then. That did us pretty well. So the answer is who is benefiting from us being sick is the question. That's what's important to understand, that sickness is, there's money to be made in that. Our goal is that we're not sick. So you see us less. That's optimal health.
Yeah, I find the Randall cycle. I get his posts every morning too, and I read through them and it's good to read through that and
My,
understand.
the reason I bring that up was I was diabetic 20 years ago.
Mhm.
At that time, I was doing triathlon, and I ate 3 meals a day, 3 snacks a day, oatmeal every morning, all the stuff you're supposed to do. And again, I was a OB, and I took care of a lot of diabetics, and I was the expert, and I
Oh,
was such a bozo. And I read Mark Sisson's book, Primal Blueprint, in 2011, just changed my whole everything. So I got really into avoiding that stuff. But then myself, I saw myself I'm not saying stagnant weight wise, but more energy wise.
mhm.
And I'm testosterone optimized, my workout's working well. But I find by adding a little bit of fruit within my window of time, I eat about 6 hours a day. It actually changed. And then McCullough, and not that I invented the Randall cycle, but it brought some point, made some sense to me, because certain cells in our body would rather use simple sugars than break muscle down to lose
Yes,
glucose.
yes.
So you got to make sure. And what he talks about is basically 30% fats like optimized. But again, this is after we got rid of insulin resistance. Keto, fasting. There's a great book for women called Fast Like a Girl by Dr. Pelz. And she goes through how your cycle, without your cycle, fast in the beginning part of the cycle, give complex carbohydrates in the middle, and fast in the end. And she talks scientific. It's very, very, very
Yeah.
good book.
Yeah, I'm real familiar with Dr. Mindy. But yeah, because the Randall cycle, I'm glad that you mentioned you have to be insulin sensitive
Yeah,
for the.
don't start off the bat. That's when
Yes.
people they mess
Yes.
up. Then they
It
start
is
eating sugar again.
interesting because I've seen that in myself. I was insulin resistant, which is why I got so fascinated with this. I'm like, I'm a freaking dietitian. Same as you. Like, I'm eating all the things they told me to eat, and I'm at a healthy weight, but I was insulin resistant. I was hungry all the time. I had cravings. fix that, but now I'm getting these higher morning blood sugars, and my adrenal health, like my
Have,
cortisol
have you
is
done your,
flatlined, like it's to the point, like my cortisol pattern is flat throughout the day. So I'm starting to now eat some protein and fat in the morning and stop eating like late afternoon and do my intermittent fasting, if you want
I
to call
agree.
it that way instead, just to try to get the cortisol pattern back at normal.
Are you on any ashwagandha or anything for your adrenals?
I have in the past, but I've been kind of on and off that, but
I have a great saliva test and I have a whole plan based upon that curve.
yeah,
We have some very good results with that. But again, let's talk about your testosterone. You get those hormones optimized. I tell everybody in the hypo and the anterior pituitary, we have 6 hormones. 5 do the function, and then the 6th one is the cortisol, which responds to stress. Cortisol is life-saving for seconds at a time. It's life debilitating if not chronic. So you don't get rid of your cortisol, and you want it to right, it does more than secrete sugar as you read the whole Brannon cycle. It's life saving. It makes us breathe. It makes us, turn sugar and energy. All of this great, but it's the right balance of that.
yeah,
And I find, the adaptogens have been very beneficial when I find this curve. It takes about 3 to 6 months to get back to get to a normal curve pattern, but it happens. But I think the first step is to make sure you're optimized, especially in your sensitive part of your age, your perimenopausal stage, is you get your sex hormones optimal. I think you'll notice something in about a week.
oh wow, yeah,
Yeah.
yeah, and going back to Dr. Mercola, I know he's eating like 300 to 400 carbs a day. I'm like, I don't think
No,
I
I'm not there. I'm not there. I'm personally,
can do
I
that.
love 6 hours a day. And my also, if I'm 4 hours a day, I stay two. If I can want to get bigger, not heavier, but bigger muscle, I go about 68 hours a day and add a little bit of fruit. It makes me more physically strong, bigger.
Yeah, yeah, right, and yeah, all these hormones, it's just like a Goldilocks effect with, and women are fluctuating more than men are, and especially as we get older. So there's just so
It's
many.
shame, but nothing works in our body in isolation. That's why it's all intercomplex. And to say knows everything is full of garbage. I know one thing: given the right substrates, my body will do what it's supposed to do. I don't know what it's going to do. I can't, say it does this. I just know it does it if given correct stuff. The most important thing is sleep. That
Yes,
is the most.
yes. Yeah. And that's why I'm like putting out a lot of messaging about getting our natural circadian rhythms back in check and using our lighting environments for that. Because unless you have that restorative sleep and that melatonin coming into play at night, blocking the blue light so that
Yeah.
you don't have cortisol stimulated at the wrong time of the day, that's just so beneficial in healing. And yeah, it's like people just think it's not that big of a deal. Like, oh, I sleep
No.
good times. Like no, it's like these foundations that we're just like whip through, like you gotta sleep, it's like, no, these are
You
huge.
think about somebody with a bad brain injury, your body puts yourself in a coma. I mean, no, sleep is
Right,
crucial.
right, right. Okay, so I think we talked about most of the things I wanted to ask you about. Oh, one more thing. Is this something, hormone replacement therapy? I think what I've heard you say before is that, you just kind of keep doing it if you're feeling
Yes.
optimized and you're feeling your best self. Would you recommend like testing every 3 to 6
Oh,
months?
no, no. Yeah, I test
Oh,
within every 3 months and every 4 months. Yes, ma'am.
okay.
The data is very, very, very important. Stress changes, little things changes. I want to keep you optimized. That's very important. Yes, ma'am.
Okay, perfect. So you have practices around the Southeast and then in Texas, not
Mhm.
by me, unfortunately. Do you do any
Yeah.
virtual practices, or are you maybe?
We have, yeah, I'm licensed in a bunch of states, so we do a lot of Zooms. People fly into us where one of our offices
Okay,
are at. Our goal is to go where you guys are. We're open in Florida in the third quarter. Well, more in Texas. We're looking around. We look
yeah,
around. We're just the key is to make sure that if you walk into any office in Charleston or Charlottesville or North or Raleigh, they're identical. Everything runs smoothly. You're very, very fortunate on our reputation, and we just want to make sure that we just treat the individual as an individual. That's all I care about. But expansion, yeah, we are expanding at a rate that allows us to not lose our quality, but reach more people. Yes, ma'am. But
perfect.
I've been doing Zooms for years.
Yeah.
That's why I'm
Okay.
licensed in a few states, and then people get their labs drawn where they live,
Yeah.
and then they come to one of our offices. Yes.
Okay, gotcha.
So
And
there's all these internet laws. We make sure we're
yeah,
perfect in every little law.
sure. Yeah, you gotta, you don't want to lose your medical license, that's for
Oh no,
sure.
no, we're above reproach. My CEO is an attorney, so we know everything is
Oh,
by the
yeah,
book.
that's good. And your book Restore just came out not too long ago,
Yeah,
correct?
it's an Advantage that it for publishing published it. It's the first and only hardback book on pellets ever. It's 85,000 words. It has 500 references. Put a lot of data in there. It basically the beginning is more of a story. Basically, the journey of a woman's life, the journey of a man's life, looking for the so-called Holy Grail. But the Holy Grail is not being youthful. It's again, I can't stress the benefits of getting older is tremendous wisdom, knowledge, learning. Now we tie that together with youthful chemistry. I think our best years are ahead of us.
Yeah.
So it's called Restore. My first book's called The Hormone Handbook. It's about 120 pages. It's the nuts and bolts of what we do. Restore is a story, and then I have a ton of science at the end, and then I have a whole section in the back on medical liberty. And I
Okay.
also, it's going to be it's on Kindle. I'm doing a special on the Kindle for like $1. But I also put an audible book. So it's going to be audio book as well.
Excellent. I like the medical liberty part there.
Oh, that's my I can't stress my
I,
passion on
I
liberty.
think we're speaking the same language.
I am a freak on liberty.
Awesome. Is
And
there
my
anything?
side note was is I'm a constitutional passion guy, and I'm that's my I say that word as an expert. I studied that for 20 years, so I understand how that works very well.
We know we need more of that in
Yeah.
these times for sure.
But I ran for Senate. I
Oh,
lost a
cool.
very close election. I was endorsed by guys like Ron Paul, Rand Paul, that kind of stuff.
Yeah, yeah. Is there anything I didn't ask you about that you would like
Oh,
us?
and I could talk to you forever. I don't. I become a fire hose, and I know that. And I want you to be. I want to be very black and white. My first book, Hormone Handbook, I wrote at the beginning. I wrote my arrogance led to my ignorance. I thought I knew everything. I got
Yeah.
all these degrees. I knew all this crap, and I know everything. That arrogance allowed it hurt me individually. It hurt my patients. Um, I just want health. I don't want. Again, here's the thing. Nobody knows your body, Shannon. Nobody more than you. So what happens, what I really love about Optimal Bio is like I have one consult fee for your whole life.
Hmm.
We never charge more than the first visit. Never. I'm not here to sell pellets. I want you to, it took me 2 years to convince myself and my wife to go on this. So I want this to be an education process. So you ask questions. So I have a big whiteboard behind us. I draw pictures of how the brain works. I don't care if you're a chairman at Duke. I don't care if you went to high school. I do the same talk because I believe the capacity to learn is very, very important. So the bottom line is it's you got to listen because your story is going to take me down a journey, right? And then we try to plug in how the body works for your journey. And then the key is in 1 month, we check all your labs again and you grade us. I always say 0 out of 10, how do we help? And after 60,000 placements in 5 states, we have a 98% retention. So I don't know, honestly, I don't know what we're doing. I know what we're doing is bringing people back because they tangibly feel it. They're off their antidepressants, their relationships are better, they're attacking the world, and they just feel like themselves. That's my passion. That you can't be. There's a quote I put in the back of my book. It says, "We do not become conscious of the three greatest blessings in life, such as health, youth, and freedom, as long as we possess them, but only after they lost them." As
Mm.
author Schegerberg. What I want to do is have people be passionate as possible about life. Your journey, and go for it. That's my passion.
Yeah. Yeah. And it takes a big person to admit and come to terms in their career. This happened to me about 10 years ago. Like, I don't know everything. And one thing that I'm telling people doesn't work for everybody. And I've done some pretty big pivots in my career as well. And Dr. Fung's book was one of those. After I read that, I'm like, oh my gosh, I'm teaching everything
I
incorrectly. I
know.
want to go back 15 years and take back most of
And
what
I
I.
got a daughter. One of my daughters has got a degree in nutrition, and like, oh my, she comes to that kind of stuff. Like, oh my, she knows what I'm teaching her, but she got to get through her test. And it's like, okay, I got to like, God, get through your test. But it's like,
Yeah.
and it's just, in fact, Optimal Bio, we're putting together. We have a wellness program coming in 2 weeks. That's going to tie everything we do together, plus individualized wellness for diet and workout for each individual as well. That's coming out in 2 weeks. So again, edification, knowledge is power. That's what this is really about. And like, look how many people you touch because you got passionate. Use your degree, use your knowledge, you use your experience, good and bad. And now you get on this thing called internet and you tell your story and you affect lives every single day. And that makes us, when you go, because if a patient comes to me and questions me, I like that. A lot of doctors don't. You know what? Change doctors. Change
Right.
doctors. You
Yes.
know, there's times you have to get advice you don't want to hear, but it's nice to get different opinions. When I was a surgeon, I always say get a second opinion. You
Mhm.
always get a second before you get touched. It's just you have to. It's important. But become your biggest advocate. Never, if a doctor won't spend time talking to you, then I recommend changing doctors.
Yeah, yeah. One last question. If people are not in your area and can't fly into, are there any recommendations that you
No, I
have?
don't recommend anybody else, but I recommend look. You may find the guy in Green Bay. You may find a guy in Chicago. I don't know. Just look. There's a lot of doctors waking up. They're going to classes. They're learning. A lot of doctors are getting hormones and they start with creams first because it's a little easier to do a cream.
Yeah.
I don't do creams because 40% of women and men can't absorb it.
Okay.
And if I didn't do pellet, I would do bioidentical creams. But
Okay.
again, the absorption rate's key to me. But find somebody who's done a bunch of things and quiz. You may like, I don't know. I've had nobody go back to creams or shots after 60,000. So I believe this one works. But I'm not the only guy in town. I got that. But make sure you go get a police writer a book so you're knowledgeable when you find somebody, and then you quiz them. Make sure they understand what you're looking at, what kind of talking to. But I believe you'll find other great places out there, not just our company.
Awesome. Well, at least we have your book if we can't work with you
Mhm.
directly in company. So, well, great. This has been a really enlightening conversation and really fun to talk with you. We appreciate the work you're doing. My gosh, it's just when you think about you don't have to go through perimenopause and menopause or even men who are having all of these symptoms. Like there's a better solution.
Oh,
And
yes.
you just have, like you said, educate yourself, ask questions, interview your doctor per se. If you don't like them, move on to somebody else,
Move
him,
on.
yeah. So
If
great.
a,
Thank you so much.
if a doctor says to you, because I said so, I would leave. I want to hear why I believe what we may not agree, but you know what I'm thinking. And I think that's important is to so you know what you're thinking of, not just because I said so.
Yes, couldn't agree more. Well, thank you so much for your time and for being here and for sharing all your expertise with us.
My honor. Thank you so much.